Hello, and thank you for joining me on the COVID-19 Info News channel. And what I'm going to talk about today is this is actually going to be quite a short video. Just want to talk about interferon alpha B2 recumbent, which I mentioned in a previous video, the so-called Cuban wonder drug. And what it is a very effective cure, actually, for, well, not a cure, but a very effective therapy for COVID-19. That has been successfully used in China among countries like and Germany. And Germany is actually presently asking for some of this from Cuba as of in April 2020. So apparently this drug is actually quite effective. And I did mention this in a previous video that Cuba is getting requests from all over the world for an interferon alpha B2 recumbent, because it appears to be a very effective drug for treating COVID-19, and there's been a lot of success. Uh, but the reason it's not being used in many places is because of U.S. sanctions on Cuba. So apparently politics is playing quite a role in preventing this drug from being more widely used, particularly in countries that are friendly to the United States and the United States itself, or countries that follow U.S. sanctions, or go along with basically U.S. sanctions, are not allowed to use this drug. So even in the midst of a crisis, which we're going through now, unfortunately, interferon alpha 2b recumbent is not being used, which is very strange. It's not even really mentioned anywhere. You really don't hear it mentioned anywhere. And that brings me to the story that there's a story in Reuters about this drug. And it's actually it's quite a recent story, and it's very strange. It's a brief. It's not even really a story. It's almost like it's a secret or something. Like nobody really wants to talk about it, because of apparently because of the sanctions. Not many news outlets are willing to talk about it. But what I wanted to mention here is that this is, and I will post a link to this story at the bottom of the video, as well as the first video that I did put out on this subject of interferon alpha 2b recumbent, the so-called Cuban wonder drug. But anyway, this story is from Reuters again, and it's April 20th, so really not that long ago, about 2 weeks ago. And it's from Cadila Healthcare. Again, it's a brief, and the title is Zydus explores biologicals route to treat coronavirus with interferon alpha 2b. And as I stated, I'll post a link to this story in the bottom. And it's a very short story. It actually says a 1-minute read. And it's a brief. It's not an actual story. It's just a couple, like 4 lines of information regarding this, this very important drug, which could be used to treat COVID-19, but is really not being talked about very much in the media, which is very strange. So anyway, I'll read the story because it's very short. Again, it's just a 1-minute read. Cadila Healthcare Limited, Zydus explores biologicals route to treat novel coronavirus with long-acting interferon alpha 2b. That's one line. Then the next one, Cadila Healthcare, interferon alpha can potentially emerge as a treatment option for COVID-19. Next line, Cadila Healthcare, in vitro. In vitro in vivo studies suggest positive effects of interferon alpha on COVID-19 patients. So it states right there from this brief from Cadila Healthcare that interferon alpha is, positive, has positive effects. That's a direct quote from the story on COVID-19 patients, and yet it's not being mentioned anywhere. There's practically no mention of it in any news outlets. Excuse me, there are 5 lines, not 4. Cadila Healthcare Limited is the next line. Zydus approaches Department of Biotechnology, India, to investigate the role of pegylated interferon alpha 2b for COVID-19. Pegylated. And the next line, Cadila Healthcare, working with U.S. FDA to open an investigational new drug filing for pegylated interferon alpha 2b. So it is being studied. According to this, as of April 20th, even in the U.S. FDA, and it also says Cadilla Healthcare Limited ready to undertake clinical trial. Source for text icon, further company coverage. And basically that's it. It's just a very, very short story, a very, very short mention of what could potentially, change the game, alter the game completely as far as, the coronavirus goes and COVID-19 goes. And it just strikes me as extremely strange that nobody's mentioning it. It's a brief. It seems like it's a very important story, at least in my opinion, from my perspective. But nobody is talking about it. It's a Reuters story. It's just a couple, basically 5-6 lines of information, little briefs, a 1-minute read on what is potentially a very important drug, and I don't hear it mentioned anywhere in the media. But anyway, so this is the brief, and I'm going to keep this video brief, in the spirit of that. And I'll post a couple links to the story, which is quite important in my opinion, but it's not being talked about. And if you feel free to comment on this, and and why you think that interferon alpha 2b is not being mentioned anywhere, even though it is being studied according to the story by the U.S. FDA, which seems like quite an important development. And the only reason I can imagine that it's not being mentioned is because of the U.S. sanctions again on Cuba. And it's been effectively used in China and Cuba, and many other countries are clamoring to get this drug. So anyway, draw your own conclusions. But I will post a link to this, and please feel free to like, subscribe, and comment on this story, this short brief. And thank you very much. And please, everyone, please stay safe out there, and and watch yourselves and take care of each other. Thank you. Bye-bye. See you next time.